Assalamualaikum. Hello to our beloved human physiology lecturer, Prof. Madya, Dr. Nabilah binti Ibrahim, and all my fellow friends. With me, Muhammad Umairul Ashraf bin Fakul Arifin, as your chairperson today. The digestive system is a series of hollow organs joined in a long twisting tube from the mouth to the anus. Inside this tube is a lining called the mucosa. In the mouth, stomach, and small intestine, the mucosa contain tiny gland that produce juice to help digest food. So uh, two solid two solid organ, that the liver and the pancreas, produce digestive juice that reach the intestine through small tube. In additional part of other organ system is, for instance, nerve and blood play a major role in the digestive system. So before we go further, let me introduce to all of you about our panel, because most of them have a lot of knowledge and also experience about this topic that we will discuss. So for our first panel is Muhammad Haraizat bin Baharom. Then second panel is Muhammad Auji bin Zulkifli. Third panel is Navin anak lelaki Sokalingam. And the last panel is Muhammad Akmal Hafiz bin Hishamuddin. So I hope all of you was in pink herb. So without wasting our time, let we go to our discussion. Topic today is gastrointestinal system in scope of absorption and digestion. For my first question to our first panel is to Muhammad Haraizat bin Bahrum. Can you mention to us about the function of absorption and digestion?
Okay, thank you to Muhammad Umairul Ashraf as our chairman. So I am going to explain about the function of absorption and digestion. First, I will explain the meaning of digestion. Digestion begins even before we put food into our mouth. When we feel hungry, our body sends a message to our brain, and that is time to eat. Sight and smell influence our body preparedness for food. Smelling food sends a message to our brain. Our brain then tells the mouth to get ready, and we start to salivate in preparation for a delicious meal. Once we have eaten, the digestive system will break down the food into smaller components. In another word, we can call it as catabolism, which is catabolism functions on two levels, mechanical and chemical. Once the smaller particles have been broken down, they will be absorbed into the blood and delivered to cells throughout the body for energy building block needed for cells to function. Right. Next, the digestive system is one of the 11 organ systems of the human body, and it is composed of several hollow tube-shaped organs, including the mouth, pharynx, esophagus, stomach, small intestine, and large intestine. Smooth muscle tongue surround the digestive tract, and its contraction produced with no put down the tract. Alright, so next point is I'm going to explain about the absorption. Absorption is the movement of digested food molecules through the wall of the intestine into the blood or lymph. The small intestine is especially adapted to allow absorption to take place very efficiently. It is very rich pass through the wall of the intestine into the bloodstream. Water, minerals, salts, and vitamins are also absorbed in the small intestine. The small intestine absorbs about 5 to 10 of water each day. However, the colon absorbs much less water and salt than the small intestine. So I'm going to explain the significance of villi. Villi are finger or light projection that increase the surface area for absorption. If a section of small intestine was turned inside out, and its surface would be like a kit or a carpet. Inside its villi are blood capillaries and lacteals. Okay, so that is my explanation. Thank you. And I will send to Muhammad Umairul Ashraf.
Okay, thank you to the our first panel. So from what of Muhammad Harizat said, now we know that how the function of absorption and digestion work in our body system. Alright, for my next question is to Muhammad Auji bin Zulkifli. Can we know how to maintain observation and digestion, and can you explain to us?
Okay, thank you to Muhammad Umairul. Okay, now I want to explain about how to maintain absorption and digestion. As we know, absorption and digestion is an important thing in part of our body. So we need to care so to keep it in maintain. What it means of important that digest food molecules are absorbed in the small intestine. This means that they pass through the wall of the small intestine and into our bloodstream. Once there, the digestion food molecules are carried around the body to where they are needed. So, how to keep how to keep it maintained? There are seven best way to improve your digestion naturally, and there are few ways to improve your naturally absorption. Okay, I want to show you the seven best way to improve your digestion naturally. Okay, first you eat the high fiber diet. Be sure you're getting both soluble and insoluble fiber. Third is minimize your intake of foods high in fat. Fourth is select lean meats. Five, add probiotic to your diet. Six, follow a regular eating schedule. Seven, drink plenty of water. But how about to improve your naturally absorption? First, eat a variety of food in one meal. Second, pair vitamin C rich food with iron. Include healthy fats with each meal. Fourth, take a probiotic. And lastly, avoid drinking tea at mealtime. Okay, that's all for me. Thank you.
Alright. Uh, Alright, thank you to our second panel, Muhammad Auji. So, to make more our forum flare up, I want to ask Navin anak lelaki Sukalinggam, can you share with us about gastrointestinal system of observation and digestion, disease and treatment?
Okay, first I would like to thank Mr. Umairul Ashraf. Okay, today I will talk about gastrointestinal system of absorption and digestion disease and treatment. Structural gastrointestinal disease are those where bowel looks abnormal upon the examination and also does not work properly. Sometimes its structural abnormality needed to be removed surgically. Okay, there's a 5 type of disease I would like to talk today. First, constipation. Constipation is normally because of roughage or fiber in our diet or disruption of a regular routine. Constipation causes you to strain during a bowel movement. Constipation also rarely a sign which you have a more serious medical condition. Second, irritable bowel syndrome, as known as IBS, functional condition where your corneal muscle contact or more or less often in a normal state. Because of a certain food, medicine, emotionally stress or some other factor that can trigger IBS, irritable bowel syndrome. Third disease, hemorrhoid. Hemorrhoid is a dilated vein in an anal canal, structural disease. This is a swollen blood vessel that line your anal opening. They are caused by chronic excess of pressure from the straining during the bowel movement, persistent of diarrhea or pregnancy. There are 2 types of hemorrhoid, internal and external. First, internal hemorrhoid, a blood vessel on the inside of your anal opening. When a fall down into a anus a result of straining, they become irritated and start to bleed. Ultimately, internal hemorrhoid can fall down enough to prolapse. Stick it out of your anus part. External hemorrhoid, a vein that lies just under the skin on outside of a anus, sometimes after a strain, or internal hemorrhoidal vein burst and blood clot form under a skin. That's a very painful condition. It's called pale. Okay, for the fourth disease is diverticulitis. Diverticulitis is infection or inflammation of pouching that can form in your intestines. This pouch is cool. They can show up anywhere in your intestines. If you have them, it is called diverticulosis. It becomes infected or inflamed. It will have a diverticulosity. The last disease I will talk today is heartburn and also esophageal reflux disease, known as GERD. Heartburn and GERD is irritation of esophagus, that tube that connects your throat and the master, lead to a burning discomfort in your upper belly or below your heart bone, breastbone. Okay, heartburn has nothing to do with the heart, but it also a symptom that similar those heart attack or heart disease. Okay, now I will talk about the treatment for the 5 type of disease. First, constipation. The treatment is increased amount of fiber or water in routine intake of your food. Second, exercise regularly and increase the intensity of your exercise as tolerated. Fourth, moving your bowel when you have urge. Resisting the urge cause constipation. Okay. The second, first, avoiding excessive caffeine. Avoid drinking caffeine a lot. Second, increase the fiber in your intake food. Monitor which food trigger your IBS. Okay, avoid that food that trigger your irritable bowel syndrome. Okay, minimize your stress or learn different way to cope your stress. Okay, taking a medicine that prescribed by your doctor. Avoid hydration and dehydration throughout the day. Getting a high quality of sleep. For the third disease treatment, hemorrhoid. Okay, lastly is the ask for consult your doctor that your hemorrhoid need to be surgically removed or not. The fourth disease and treatment, if you are divertical in mild, your doctor will suggest a rest or liquid diet while you are intensively healed. This might also give you antibiotic treatment to infection. In more severe cases, you might need to stay in a hospital. Taking antibiotic is relieve your divertical system and your part of the divertical burn. First, a medicine is antacid. This medicine lesser the acid in your stomach and ease your heartburn pain. Then also sometimes help the stomach pain and indigestion and gas problem. And proton pump inhibitor. This drug lesser the amount of acid in your stomach makes that calms your stomach digestion and stomach ache. That's all from us. Thank you.
Alright, so thank you to Naveen for sharing about gastrointestinal system of observation and digestion disease and treatment to us. from the info we get from Naveen, we have a lot of input, disease and treatment about our topic. So for next part is I want to ask to our last panel is Muhammad Akmal Hafiz about the conclusion of how the system observation and digestion works. Can you share with us?
Thank you, Muhammad Mairul. My name is Muhammad Malafis. I will conclude our studies about digestive system. The digestive system is very important to our body. The digestive system of human consists of an alimentary canal and associated digestive gland. The alimentary canal consists of mouth, buccal cavity, pharynx, and esophagus, stomach, small intestine, large intestine, rectum, and finally the anus. Inside the mouth, the teeth masticate the food, and the tongue takes the food and manipulate it for proper mastication by mixing it with the saliva. Saliva in our mouth contains starch, digestive enzyme, salivary amylase that digest this starch and convert it into a maltose. The food then passes into our esophagus, which is further carried down through the esophagus by peristalsis into the stomach. In our stomach, mainly protein digestion take place. And absorption of simple sugar, alcohol, and medicines also take place in our stomach. And then, after that, food enter our duodenum portion of the small intestine and is act on the pancreatic juice, bile, and finally by the enzyme in our circus entericus. And then, the digest food end product are absorbed into our body through the epithelial lining of the intestinal villi. And lastly, the undigested food enter our cecum of large intestine, and in our large intestine, water from our digested food is absorbed in the large intestine, and lastly, the undigested food becomes semi-solid in nature and then turn into rectum and finally ingest out through our anus. That's all.
Alright, thank you to our last panel, Muhammad Akmal Hafiz, about your sharing. So actually there are a lot more question and answer that I want to share with you guys, but it was too late. So what I can conclude from our forum is we need to care of our healthy to make sure our body in good condition. And from this topic, what I can say is food also play a main role to care of our organ in the body. So lastly, I hope you guys can get many input from this forum, and before we end off this forum, our team was prepare a video about this topic, and I hope you guys enjoy for this video. That's all for our team, and thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Malafis. In this video, I will explain a bit about our gastrointestinal system. How food that we eat get digested in our body. There are 4 steps in indigestion, that is ingestion, digestion, absorption, and elimination. The first step is ingestion. We use our mouth to chew and swallow the food, and then the food goes to esophagus. This is our esophagus that is connected to our stomach. The esophagus is a muscular tube that connects mouth to stomach. After that, the food enter our stomach, and then the gland in our stomach lining make stomach acid and enzyme that break down food. This is our inner part of our stomach. Beside our stomach, we got liver and pancreas. This is our liver, and the back side is our pancreas. Both of these digestive system produce digestive juice and deliver it to the small intestines. This is our small intestines. Our small intestine has three parts, that is duodenum, jejunum and ileum. The wall of small intestine have something finger-like projection called villi. It absorbs all the nutrients from the food to our bloodstream. After that, digest food goes to our large intestine. As we can see, our large intestines also have three parts, that is ascending colon, transverse colon and descending colon. As you can see, this is our large intestines. This is their part. The digest food will be reabsorbed in here, in large intestines. Large intestines will reabsorb water, salt and some vitamins. And then finally the undigested food becomes semi-solid in nature and then enter into our rectum and then finally just out through our anus. That's all, thank you.